thee for all of our source of strength and guidance, and even the plan of life everlasting is thine. Bless our leadership, bless the cause that we serve, direct our course, and make us useful each hour for thy plan. In Christ's name, amen.
Thank you, Ms. Sandy. We have a roll call at this time. Will?
Mhm.
Present. Okay. Mrs. Dawn is present. Ms. Hudson?
Present.
Ms. Webb?
Present.
Ms. Lesnier? Ms. Gray?
Present.
Ms. Stanley?
Present.
Ms. Miller?
Yes.
Ms. Rosenberg? Ms. Wood? Mrs. Langston? Mrs. Davis?
Here.
Ms. Smith? I did have, I think all of our persons not here did contact us. I saw Ms. Barron, Mrs. Lewis called to discuss the meeting since she learned today that she would not be able to be here as planned. Ms. Emmons, have you called? Mrs. Langford also called and said she was ready, but she wasn't here this visit. So I think people counted for. I appreciate all of you coming out in the weather today to make the day. And the reason that we're having a fall meeting was that our district legislative committee did meet and felt it pertinent to give us a report and have some recommendations to bring to the members of the board for action or consideration. So with Ms. Barker, chair of this committee's kind consent to most call a date that might be convenient to most of us. She stated she would come and bring her report to the members of the board. So at this time, we'll ask Ms. Barker to give her report.
Thank you, Madam President and members. The Committee on Legislation for the 5th District, Georgia State Nurses Association, had a meeting in my office on January the 25th at 10 o'clock in the morning. The following members were present: Bernice Dixon, Helen Graves, Joshua Bossier, Chairman, and Carolyn Axes. We had heard from Ms. Ditchfield had planned to come, and due to the illness of Mrs. Buffington, she was not able to be with us. And Dinah Tumlin, I understand, is a student at Medical College of Georgia School of Nursing in Augusta, and she was not able to be in Atlanta for this particular meeting. But since we had 3 out of 5 present, and Ms. Atkins attended also, we felt that we should go ahead. This meeting was called following a meeting of the State Committee on Legislation, at which time we discussed a number of moves of interest to the Nursing Association. At our meeting, we approved 2 actions following the pending the approval of the Executive Committee. One was that we draft a letter from the 5th District Committee on Legislation, signed by all of the members present, to the Representative James H. Floyd, Sloppy Floyd as he is known, who is chairman of the House Appropriations Committee. And the second was that we draft a letter that would be sent out to all of the senators and representatives from the 5th District particularly those who are on the Committee on Health and Welfare and, something in hygiene and sanitation, but we agreed the committee wanted to send this copy of this letter to all of the representatives from the 5th District, and I would like to read the draft of the letters that have been approved by the committee, and we would like to get them out immediately following this meeting with the approval of this committee. The first one to Representative Floyd says, Dear Sir, as a group of active nurse members of the 5th District Georgia State Nurses Association who are concerned that Georgia citizens have available top-quality nursing service, we urge that you and your committee weigh very carefully any decision to cut appropriations which may hinder the progress of nursing education in Georgia. We are cognizant of the responsibilities which you have and the tremendous burden it places upon you and the members of your committee. We know, too, that you join us in our desire to provide high-quality nursing care for Georgia citizens and hope you will take note of the sincere efforts of many nurses to upgrade the quality as well as quantity of nursing service. We cannot do this without programs in nursing which are educationally sound. Please feel free to call upon us if we can be of service. Signed, 5th District Georgia State Nurses Association Committee on Legislation. And I don't really know what the proper procedure is here, but we are asking for the endorsement by the Executive Committee of this letter prior to our mailing. That's right. And would you like for me to read the other one before you?
Let me ask one question on that, if I may. As long as you list your committee, signing that person as chairman would suffice for it in order to get it out first thing in the morning?
I think so, yes.
Because we could do that immediately. I could get the letters and bring them over right to you at that time.
Right.
Well, I just
And
want
we
that
decided that it would give more weight if we put the names of the committee members and then indicated copies to the following people: Ms. Catherine Pope, President of the 5th District Georgia State Nurses Association; Ms. Carolyn Atkins, Executive Secretary; Mrs. Olive Barbin, President of the Georgia State Nurses Association; and Ms. Dana Hudson, Chairman of the Georgia State Nursing Committee on Legislation.
Before is, Johnson, I think we might talk about this, maybe before you read the others. Is there questions from any of the members regarding? Is the motion known? I move that the recommendation of the committee be approved and sent as before. Letter as recommended by the legislative committee is circulated as indicated. Is there question or discussion to this motion?
I might explain some of the feelings and expressions and why this was done. First of all, as you well know, the Appropriations Committee is in session and they are in a cutting mood, and they have apparently been, I know they have been discussing many cuts, involved is the Board of Regents proposal for all of their programs. And this was discussed in the State Committee on Legislation, and we were urged as district members to take action accordingly. Alda Ditfield, of course, felt like she had a vested interest in this, being an employee of the university system, and I felt that I had to tread cautiously because the Department of Health budget is in jeopardy also, and I did not want to say specifically here that we felt that this program should be supported and possibly jeopardize some other programs which are equally important. So we tried to tread a sort of a middle ground in a sense, and yet let our feelings be known that we felt that education was an important program. I had wanted to talk with Dr. Venable prior to this meeting to see if he would object, or prior to our committee meeting, to see if he would object to us saying anything about programs for both health and education, but I was not able to contact him, and I would not propose it before I had discussed it with him. So this is the cause of the proposed cut in the Board of Regents budget.
I hate to speak down here, but is there anything specific going around about what will be cut? I would assume new schools that are in the process of being established would get hit. But I've heard many rumors and gossip. Is there anything that you've heard in relation to this?
But I'm not sure that I can clear this up, and Ms. Hudson may probably be better informed on it than I, but it is my understanding that the Board of Regents, in proposing that budget, apparently do not present the kind of budget that comes from the Department of Health, for instance, which actually itemizes the various areas and programs specific, like Louisville State Hospital and what will be done there, and buildings all over the Hill Burton Plains and all of this. But they have a sort of a lump program, and the fund that, according to their budget, is in most danger, according to what I have heard now again, is what they have called an enrichment program, which apparently is that money that is over and above the ongoing day-to-day operations to stay right where they are now, but to increase faculty in various schools and possibly establishment of new programs. And which new programs, I do not know. And as you well know, the university system is made up of a series, actually, of sort of independent operators, and each unit has its own plan and budget. And so, for instance, Dean O'Rear, Dr. O'Rear down at Medical College of Georgia, would have to make determinations there, I would assume, as to what plans he had proposed that might have to be cut out if the funds were not appropriated. What do you think?
I would like to ask a question, if I could. It's my understanding that the appropriation for the Board of Regents was increased 40% and approved by the new governor. And that this, you mentioned the enrichment part of it, but that was something that was added over and beyond that. And that the program, that the appropriation amounted, the present state appropriations to the budget of the university system is $71,713,000. And that's to be increased. Now that's to be increased and been approved by the governor and promoting it. And that's to be increased to $99,900,000. And this may not be correct information that I have, so I'm just having to ask a question about it, but it seems that, and I may be wrong, but I don't see how hardly they would cut out anything when there's an increase in the budget of 40% over and beyond the present budget. That's beyond what they're operating on now, 40% increase. And this other budget was drawn up, you see, with a tax increase in view. Well, of course, the governor's not going to look favorably on increasing taxes when I don't know exactly what he said about it, but nobody wants to increase taxes while they're not. But now, if I'm incorrect, somebody straighten me out on that. That's what I've heard was the figures, and maybe you could help me out. I don't know.
probably, Ms. Hudson, have more correct figures than I do, because I have no figures on the Board of Regents proposal at all, but I do know that each department has submitted, in proper time, a proposed budget for the biennium, and then, ex-Governor Sanders made his proposal, and then Governor Maddox has made his proposal, and it is my understanding that the Appropriations Committee are cutting the Governor Maddox, are making proposals to cut the governor's budget, a proposed budget. Now, whether or not this will go through, because it still has to be.
Well, I tell you, it seemed like when you read that letter it was kind of harmless. Would you mind reading it again?
Well, I hope it's going to be more than just not harmless.
Well, you could do harm if you want.
This is right, and we don't want.
If you put too much in there.
We said that we, as a group of active nurse members of the 5th District Georgia State Nurses Association who are concerned that Georgia citizens have available top-quality nursing service, we urge that you and your committee weigh very carefully any decision to cut appropriations which may hinder the progress of nursing education in Georgia.
Well, that's all right. There's nothing wrong with that. You're not spelling anything out.
This is right. This is what the position that we actually wanted to take, that we did not want to say, do not do this or do not do that, because we don't know all of the facts that are facing the Appropriations Committee, and we have to admit this. But we just want them to weigh carefully any decision that they make.
To let you know of our concern.
This is right. This is right, and to let them know that we were citizens who had concerns and were voicing our concerns.
Well, I don't believe that if appropriation stands as recommended with 40% increase over the present budget, I don't see how it could possibly affect it.
But sometimes, Ms. Hudson, I know from ours, it takes a certain amount of increase to carry on. This is right, because you have in-grade salary advances, Social Security payments, retirement payments, and all of this, which is proportionately increased each year. And so, to maintain even the current level of teaching, I suppose, in all of the university system programs, it would take a certain amount. Now, how much, I don't know.
Well,
and I'm sure that
increase is pretty good over present operating budget.
Was that the total budget? Is that for the Board of Regents?
Board of Regents.
That's the Board of Regents.
Well, why did the Board of, so many on the Board of Regents have, seven called in?
Yeah, that's what I was wondering too.
Well, they had planned this enrichment program, which I don't know a thing in the world about, and I can't describe it. But it's supposed to be over and beyond what we're doing now, and what is proposed now. But this is all right. Let's not. You're not saying anything specifically, so I guess you wouldn't get in trouble. We don't want anything cut that's going to take away from nursing education in the state. That's true. So, it's all right.
Is there further questions or discussion?
You did an excellent job, and
Then all in favor of this letter going out as proposed, please indicate by saying aye. Aye. Opposed by no. The motion is carried.
the next one is the letter that we drafted to send to all of the senators and representatives in the 5th District, and I have the names of those. Those are the senators and representatives that represent Fulton, DeKalb, Rockdale, and Newton counties, and there's a long slew of them. But we decided in our committee that we would like to send this letter to all of the representatives rather than just the ones on the various committees that are from our district. Those committees, obviously the members from the 5th District who will get it, who are on the committees will get the letter also. But dear senator or representative, to whomever it may be going, we start as a group of active nurses concerned with the quality of nursing care provided for Georgia citizens, we should like for you to consider carefully any legislation which would affect this quality and which might be introduced in this session of the General Assembly. We understand that 2 amendments to the Practical Nurse Law will be introduced. One will make certain changes in the number of hours for lecture and practice during the training period. We support the position of the Division of Vocational Education in this amendment. The other amendment increases the examination fee for licensure for practical nurses to $15. We support this amendment. We strongly oppose any move to license by waiver any additional unprepared nursing group. The purpose of licensure should be the protection of the public. Therefore, we feel that only those individuals who meet the qualifications for practice by education and examination should be granted a license to practice. We urge that you help us protect the public insofar as possible from unsafe practice and support us in this opposition to licensure by waiver of any additional groups. And we indicated the names of the committee and again indicated the names of those officers within our 5th District and State Nurses Association that were indicated on the other.
Would you mind reading that first, not the first paragraph, but where you're saying about their having less education or something? It was right at first. I kind of skimmed over that.
Let me just start over. As a group of active nurses concerned with the quality of nursing care provided for Georgia citizens, we should like for you to consider carefully any legislation which would affect this quality and which might be introduced in this session of the General Assembly. We understand that 2 amendments to the Practical Nurse Law will be introduced. One will make certain changes in the numbers of hours for lecture and practice during the training period. We support the position of the Division of Vocational Education in this amendment. The other amendment increases the examination fee for licensure for practical nurses to $15. We support this amendment. We strongly oppose any move to license by waiver any additional unprepared nursing group. The purpose of licensure should be the protection of the public. Therefore, we feel that only those individuals who meet the qualifications for practice by education and examination should be granted a license to practice. We urge that you help us protect the public insofar as possible from unsafe practice and support us in this opposition to licensure by waiver of any additional groups.
Would you like to know of any new developments that we've just gotten today?
Yes, ma'am. I've just heard from today, too.
Well, you go ahead and give your report, or do you want to dispose of this letter first?
I'd like to get some action. Doesn't matter. I'd like to know what the group thinks about this letter. The committee would like to recommend that this letter be mailed out from the 5th District Committee on Legislation to all the representatives and senators from the 5th District.
Madam Chairman, I make that a motion if it's in order.
Thank you.
But now that I've gotten the committee approval, I guess it will be all right for me to change it. This is the way I circulated, and I don't think they would mind some editorial changes, but I think the purpose of licensure is the protection of the public,
I do too, not.
and would be, rather than should be, would be stronger. And I don't think any members of the committee would clobber me for that.
That's the safety law. You know, like, we believe that, and we feel, you know, and it change that, so.
Where did I use
You
it?
got that something, and we feel.
with most of them.
I deleted the we feel that, and I see where you, no, we put it in a different spot.
What, I ain't asked you a question, what prompted this?
I'm glad you asked it, so I didn't have to.
Is it, waiver of practical nurses or geriatric aides, or what, or all of it?
Well, the Georgia Nursing Home Association is going, and it's more of a rumor really, they are going to introduce a bill. Maybe two. Miss Hudson, I've just heard a little bit of this today, and I have not been able to get to all of it. I, again, did not see my boss today. He's been busy, and it's been Monday all day for me too. They are planning to introduce a bill, which one, they are making two proposals according to what I just heard this morning, and this is really not straight now, because I have not seen it. I was told this afternoon that I was going to get a copy of the bill in the morning, the proposal. One is that they're going to license, they're proposing that nurses be nursing assistants, I guess, or whatever, anyway, workers, let's call them this, in nursing homes will be licensed by waiver as practical nurses. The other one is that they be licensed by examination. Then they want to introduce also a bill, or maybe attached in one of the same, all of the same bill, that we license geriatric technicians. And the scuttlebutt is that the reason they want to do this is to help them with implementation of Title 19 of Social Security Amendment. I cannot find from anybody, and I have checked with the regional office, Mayor Bowser, who has checked with the Department of Welfare over there, under whose auspices Title 19 is, that the standards, I have not been able to find any indication that the standards for Title 19 will be any different from those of Title 18. Mayor Bowser checked in Washington and was told this. I understand that our Department of Family and Children's Services are opposed to this proposal for waiver. But somehow the Nursing Home Association, according to what I have gotten, and I think others too, has gotten the idea that this will help them, that they will therefore have more licensed personnel in their nursing homes, and therefore it will help them. How, I fail to see. But,
Well, is that, is the president here and say this is being, who is that?
the Georgia Nursing Home Association is this one, and this is a Mr. Schaefer over in Columbus at present.
What did you call the geriatric,
Technician. And I really don't know, I have not seen the bill yet. I will see it in the morning, I think. I mean, the proposal. And this, somebody came to Dr. Venable either Thursday or Friday from the Nursing Home Association and gave him the two bills or proposals. And one, I think, and this is off the record, asked him to support it. Not to support it, but to introduce it, ask the department to introduce it, and the other was to support it. And he is presenting the matter to, told them that he could not speak for the department at that point, that he would present it to the Board of Health, and it will be discussed in the Board of Health meeting, which will be the 16th of this month. I do not know what the position of the department is. I know what my position is.
Are these people working in nursing homes, the technicians?
Well, they don't call them geriatric technicians. Now, we have in nursing homes all over the state a raft of unlicensed people they're called aides in some places, they're called assistants in some places, and there is no licensure program for this particular group. Now, through our chronic disease and geriatric service, we have been trying to work with nursing supervisors in nursing homes to help them upgrade the nursing care, whether they be licensed personnel or not licensed personnel, and to work with either practical nurses or registered nurses, whoever might be in charge. But it's an ongoing in-service program. Actually, some of our staff have been in the nursing homes to observe and assess the quality of care and to sort of get a feel of their problems and the climate within the home, and then to develop a plan of in-service program that will be appropriate to that particular institution. We have, in a number of the homes, as some of you well know, gone in with a team from cardiovascular disease service to, with physical therapists and nursing, to teach stroke rehabilitation, which certainly spills over, or should spill over into other programs also. There are physical therapists in the chronic disease and geriatric service who also work in nursing homes. But this is in no sense a licensure program or anything like this. It's just ongoing in-service education to help them.
Well, this is what I was wondering, if the geriatric technician has only had in-service education.
They're just really an English animal right now, just an employee.
Yes, and some of them they've had a varying degrees of preparation for the job. It depends on the nursing home. One of the problems has been in nursing homes that the nurses who are working in them have always is that the one registered nurse sometimes, or registered nurse and practical, do not actually have time. They are so involved with the delivery of care to the patients that they do not really have time to plan and implement and supervise a program for in-service education for their staff. But some of them have done a remarkable job in orientation and on-the-job training. But this is what it amounts to in most cases.
They're actually these people now with this kind of preparation.
This is right.
And
I have heard a varying amount of reports. Miss Hudson, have you seen a copy of the proposal yet? I've heard anywhere from 2 to 9 years experience as being
I have not seen any copy of any bill that's been prepared. I've watched it and asked to have copies immediately, but we've not been able to do it. But we did.
Well, it has not been introduced at this point. And one more point, and I hush. I understand too, and I know this, that they are copying this after a bill that not only got introduced but was passed, a law, I guess you'd call it, in D.C. by Congress, who controls D.C., and a commission in the District of Columbia is the licensing agency, as I interpret it, for nurses, for practical nurses. And they have introduced and passed a bill which in essence licenses by waiver people with experience. This is what their pattern was after. And I understand the State Nurses Association and the League for Nursing in D.C. did everything they possibly could to oppose this and to keep it from going through, but it has gone through, and this is what our Nursing Home Association has gotten hold of. I have a copy of that, a Xerox copy of that, Washington.
You do have, well, I have a copy here. I didn't have a copy enough. But, Mr. Aaron Barron, 560 St. Charles Nursing Home is the one that's pushing this. And, as I understand it, and Mr. Gilmore, who is the administrator of the Paulding County Hospital, is supposed to be the chairman of their legislative committee for the nurses' home. and, he's recently from Alabama. And, we made, telephone call to Alabama today and found out that, there was a law passed in Alabama and became effective January 1st, 1966, which was a 5-year waiver, and it waived the formal preparation for nurses, and they should be high school graduates, and write the state test pool examination, and they tested over 500 this year. And that this Mr. Elmore is from Alabama, and he is, of course, interested in it, knowing, that it passed Alabama last year. And this act for the District of Columbia was passed in 1966, July 25th, and it calls for 3 years experience and signatures of 2 doctors and 2 employers certifying to the fact that they can nurse safely. It doesn't require any examination.
And this is an applying examination.
No.
One of the mechanics of the test pool operation in Alabama, who prepares the test?
Well, it's prepared by the National League for Nurses.
For the practice.
Yes.
I understand that the league withdrew their examination from D.C., that they went down there and wouldn't go along with it being used in this way. I don't know.
Well, there's been some question there. I'm not confident. I don't have enough information to report on that angle. I do know there's some question about it.
And you said you didn't call for an examination?
No.
For D.C.
I passed this around if you want to see it.
I just overheard Dr. Gumble make a comment this morning that this chairman of Committee on Legislation, or a committee's member, one of the others, presented the copies of their proposals to him, and it seems that they were going along with 2, a Part A or a Part B, and as I said, I have not seen it, but one was just licensed by waiver, and the other one was by examination.
Mm-hmm.
So,
For the geriatric.
Well, no, this was the geriatric technician. I think Ms. Hudson is something else. As I said, I think it's another move. I'll get it in the morning and we'll call you when I see it, but I have not had an opportunity. Dr. Austin told me about 4 o'clock that he had instructed Rufus to give me a copy of both bills, and so I know they're 2 bills.
Mm-hmm.
One of us geriatric aid in Cameron doing for about 2-3 years.
Oh, yeah.
I was just putting 2 and 2 together. I was at an institute for nursing homes in Atlanta for Southeastern District, and Miss Aaron, or whatever his name is, Barron, contacted me to teach a course that was being sponsored by the Georgia Nursing Home Association, and this was 3 years ago, I guess. And I said, well, I don't know what made me ask that. I said, you're going to license these people? He said, we'll talk about that later. And he was such a crummy looking guy to even talk to him about it. I wonder if
He's
everybody...
very persistent, and he says that this law is going to be passed regardless. And so, I tell you, with the experience that other states are having, and with the nursing shortage as it is, I think we're going to have a pretty rough time. I hate to say that, but I'm afraid we will.
They can document the shortage from where it's going. But the shortage will still be here. This is the thing that I can't get through my sick brain. We still have these people. They are working currently, but to give them a license is not doing anything to eliminate the shortage. Their rebuttal there is that if you have license, it attracts more people.
I want to, let me say this, Dorothy. If you, can show, I think this would be our strongest point. if we can show from the regulations, which you mentioned earlier, that, just because these people hold a license doesn't mean that they're going to be approved for Medicare, for Medicare services of that institution. If we, because as I understand, the regulations say that they have to be graduated from an approved school of practical nursing. And if that is true, and we can show these people that they can license them till kingdom come, but if they haven't attended an approved school of nursing, the license is not going to help that institution as far as approval for Medicare. Is that what prompted this? Yes, I'm afraid it is, Patty. I don't know. I'm afraid it is.
Trying to get on the bandwagon. Extended care facility.
Nursing services, condition of participation, page 13 says,
All right.
the extended care facility provides 24-hour nursing service which is sufficient to meet the nursing needs of all patients. There is at least one registered professional nurse employed full-time and responsible for the total nursing service. There is a registered professional nurse or licensed practical nurse who is a graduate of a state-approved school of practical nursing in charge of nursing activities during each tour of duty.
Well, let's copy that.
I don't have to copy it. I've got it right here, and I'll give it to them.
Well, I'd like to
Mary
help
Beth
myself. I
sent
haven't
me-
been able to lay my
I
hand
gave you
on
one
it.
of these at the forum, Miss Hudson.
Well,
You
I
have a
got it.
copy of it.
Yeah,
It's
I
in,
got it.
you have a
I'll
copy.
just go back home and find it. I think I know right where it is, under Sears Roebuck catalog. That's what happened to it.
Well, would you like a copy of that?
See what
You know,
I'm
all of that thing that she has, that she can do that with me, and with that too. I don't see how they could misinterpret that to mean
Well, they
any
can't.
licensed individual.
That's the thing we're gonna have to harp on.
There is a move by some people I have heard too, and this is rumor.
That's on page what?
13.
The rumors. All right.
The rumor, that's right.
All right.
That to get Social Security to dilute its standards. And we have been going round and round about this thing of those waived practical nurses that are employed currently that do not meet this criteria. And Social Security has told us we do not recommend certification or not certification. What we do is to do the visit to establish where they meet the standards for participation and where they do not meet the standards for participation. Social Security has said that if the nursing home or the facility can supply documented evidence that the individual under consideration, quote, the waived nurse, has had the equivalency of a course in study for practical nursing, that they will accept this. And so we've been trying to go around in circles about this. Ms. Brockington from our staff, Ms. Brockington, Evelyn Brockington, is in the certification branch of medical care administration. She met with the members of the Practical Nurse Board recently to discuss this very thing with them. I am told by the Division of Vocational Education that the Division of Vocational Education will prepare and teach any specific course for waived practical nurses or any general programs, if they let them know what they want, and that they will teach the course. It will not cost the waived nurses anything to take it, and that they then, at the completion of the course, would give them a certificate of having had this particular course, whatever it was. They give them the number of credit hours, maybe something like this. The problem seems to right now stem around how are we going to determine what is the equivalency, you see, in a practical nurse program. Mrs. Osborne over in the Division of Vocational Education at one time when I was talking with her said that some courses are being offered specific, like drugs and solutions, and this seems to be a real popular request, and they have taught a number of these over the state. But it's possible that if a group of nurses got together as practical nurses and wanted something that would give them the equivalency of the number of hours of lecture, you see, they could be said to have had the clinical practice period, but if they could have the hours of lecture or something that would be certifiable, that this would be a solution to the problem. You see, we have in our merit system qualifications for practical nurses. For instance, this same clause that under merit system, a practical nurse must be a graduate of an approved school. We have a number of practical nurses who are currently employed down at Millersville Hospital, and they are awfully unhappy with me because I was the dirty bird that put this clause in the qualification. And I have said over and over again, if somebody who is working with these people will come up with a proposal similar to just what I was talking about, a statement of equivalency. I didn't call it that. I wasn't that suave in my statements, but I just said if they'll come up with some kind of documentation of some kind of programs that they have had so that we can have reasonable assurance that they are prepared to function at a level that one would expect a prepared practical nurse, well then I would support such a recommendation as a change in our requirements. But at the moment, until somebody comes up with something like this, I frankly, personally, was not willing to support any change. And I think this is the thing that we are facing with some, isn't it, about 5,000 waived practical nurses today, or 3,000, I guess.
About 3.
About 3,000 waived
They were
practical
originally about 5,000, but the attrition rate has been very high, and it's about 3,000 now remaining.
And a number of those are right at retirement and are not interested in taking any additional courses, but I understand a number of them have taken some courses.
Well, Carolyn knows about this. In the 5th District, in the registry, they required that waived nurses, the organization, the 5th District Practical Nurses Organization, required for registry membership that they would have completed, I think it was 300 hours, near that, of classroom instruction, clock hours, and satisfactory completed and hold a certificate. Now, those women have that. Now, that might be something to determine an equivalency on.
This is right. I think it's, and my position has been that I thought this was something that the state board should say at what point we have reached an equivalency. I'm not the one to say because I don't know. But if the state board would say what number of hours we could accept as an equivalency, that this, I think, would get around this problem of some of the waived nurses. You see, they don't say in this that the waived practical nurse cannot be employed in a nursing home and is not a valuable person, but what they are saying is they may not be in charge of a tour of duty, and as you well know, in a lot of them, in fact I would have to suggest the majority of them are left with practical nurses in charge of the majority of the shift. And many of them, of course, are waived practical nurses, and extended care facility certification requirements say that they cannot be left in charge of the shift, tour of duty.
So what thing is the 5th District Practical Nurse Group thinking in relation to these geriatric technicians?
Oh, they're opposed to it bitterly. They're working with us on that.
Mrs. Mull, who is the chairman of the state practical nurse group, I believe, the Committee on Legislation, has worked very, very diligently to oppose this waiver. And they are really out in numbers. And there is going to be a meeting of the representatives of the 5 boards on Thursday.
Yes.
Was supposed to be this afternoon, was postponed till Thursday. further to meet with whomever it is that is introduced.
Mr. Barron and
Mr. Barron.
Mr. Elmore and Mr. Schaefer.
we-
And also the Georgia Hospital Association and the Medical Association will have representatives there. And I was hoping when these men would see that these people were opposed to this sort of thing, that they might decide to back up and not decide to introduce legislation.
Well, Miss Bowser told me today that if we thought that she could be of any service at that meeting, that she would try to be there with us. My off-the-cuff reaction to that was that it might be better for us to suggest that they talk with her, that they seek her, rather than us have her there.
Who is that?
Miss Bowser, she's opened the regional office with the Medical Care Administration for Social Security. Also Medicare, as you know, the Title 18 that we're responsible for, and she has been the one to go over to Department of Welfare to get their statement on whether or not they would adhere to the same standards. And I thought, because after all, they are the ones who take the reports from the certifying agencies within the states, and they are the ones who say, yes, it shall be recommended or not recommended. And my personal feeling was that it might be better for her not to be at that meeting, but for us to be there and talk with the people, and then to suggest, if it seems indicated, that perhaps she might express the voice of authority a little more than we.
Well, may I ask you a question? If you say that you want to send these to the representatives and the senators from this district, did you want to send them to all of them since it's so important?
Yes, ma'am.
We would bring
All
it
of
up.
the fifth
If you
district,
make
not
them-
the,
No, I
not,
mean whole
no,
district.
ma'am.
No, just this
Each,
district.
each committee on each district, sorry, committee chairman was asked to contact their representatives, right, McCutcheon?
Yes.
Because you've been stepping out there.
These
Well,
are
other
the-
districts.
See, these are the people that
That
we vote for.
Mhm.
They are interested in our vote.
Ms. Buckfield, are they gonna know the vocational, requirement to which you refer in that letter?
The Division of Vocational Education.
He said we support their stand. I sort of wondered what their stand was. I
could
sort of figured out, but I mean, I didn't really know.
I
Well, if
wondered
you
if the
remember
men
at
would
the State Nurses Association, we agreed to support the bill, the amendment that would be introduced by the Division of Vocational Education for a change in hours. And I've forgotten what it was. Ms. Hutchins, do you remember?
The class hours increased to 800 and the clinical experience to 1,300.
I just was wondering if they would know what you were talking about when you referred to this, or if it.
But that just necessitates changing
This is what
two figures. I think that the Department of Vocational Education will get that going. It'll go through sort of in a procedural form, I imagine. I don't think
As a department bill, but I thought that since we as a five nursing group had, and in particular the GSNA, had gone on record as supporting these two amendments, that we might identify that these are two amendments that we are in favor of.
Right.
But that
Good.
anything else, no, you know.
No, I wasn't questioning whether or not
I know
we supported.
that.
I was just wondering if they would know the content of to which you are referring there. Or if they would visit themselves to look it up, is what I was wondering.
Carolyn, I think all we're trying to do is to alert them to the fact that there is going to be an amendment supported by the Division of Vocational Education, and that we support the stand of the Division of Vocational Education. I thought about this as I was drafting this, frankly, to wonder if I should be specific about those bills, and then actually not having seen the bill, which is going to be dropped into the hopper, I thought it'd be best for me not to do this, but that we supported the position of the Division of Vocational Education, which is what I tried to get And then the other one, Mr. Clifton is handling, is he not, Ms. Hudson, for the book of the licensure fee, the examination fee?
Yes, well, he's not handling it, but somebody
I mean-
else will handle it.
I'll be down to
Further questions or discussion?
I'm on my book. You might can do it. I don't usually when I see it like 2 minutes fine. It won't go.
If there are no further questions, the members have satisfied their need for information here that prompted the committee's letter, then we will act on the motion from the, that reads that the letter from the chairman of this district committee on legislation emailed to all senators and representatives of the fifth district. All in favor of this motion, please indicate by saying aye.
Aye.
Opposed, no. Then the motion is carried.
That should go out if possible tomorrow, because they'll be coming,
She said she'll do it first thing the
they'll
minute
be
she
coming,
opens the door.
they'll be coming back into session, and once they get in there, they're just crowded with everything, and the time to get them is now.
Miss Hudson, she has one of those automatic typewriters. All she does is write one letter, and then she can go ahead and write a 1 or 100 or 1,000, and then the thing, the address and all, she puts it in with the same type,
Wonderful.
just as if she's written it personally. And then I'll take them over to Miss Barfield just immediately when she gets them addressed. That's why I said specifically who we're to send them to. I didn't want her to waste time to look up the addresses when we have them here.
I would like to stress the importance of a personal visit to these people. Now, there's one of these folks that I can visit. I'm in the 5th District, and it's out on East Paces Ferry Road, not very far from where I live. And it's Dr. Cox of podiatry. And so I'm just going out there and see him and talk with him. And I'll take him, because he's right close there, and I can go without any trouble. And I do feel that we ought to do, would any of you happen to know this Mr. Westbury in the Senate?
I'd like to.
Yeah, well, I think there's two stories there. A lot of people know his father and had a lot of respect for him. But now he probably will give us some kind of trouble on this thing.
Wednesday?
Yeah.
Somebody told me whatever he supported,
everybody else supposed to, maybe they wanted to. Well, he's got to say something. But if anybody knows Mr. Westbury, he's vocal. And that may be true, but these people have a way of being heard. And you just open your mouth and talk long enough and loud enough, somebody will listen to you.
It seems like to me the person that visits really should know, and I don't know if that's easy to get to them. Who wants to go visit him too?
You can leave. Well, leave there. I don't know what he is, but I could visit his father very nicely, and usually I don't know, but somebody else to get to him, and Leroy Johnson, somebody else. Can't you visit Leroy Johnson? You could visit him.
To the hospital a lot, I haven't seen him recently.
Don't you think you could get in touch with that Miss Hamilton? Now those would be two that you could. But you try Leroy? Well, he's a good thinker, Leroy Johnson is. And I think if you approached him on this thing, I believe that he would listen to you. And don't yourself know someone.
Absolutely.
It's just as good to know somebody that does know.
Absolutely, but I did know Leroy Johnson one time too. Madam President, we had one more recommendation from the Committee on Legislation too. This was, we wanted approval of those letters and wanted to get them out in the morning. The committee reviewed all of the deliberations of the, pertaining to legislation at the Georgia State Nurses Association annual conference, and then at the Committee on Legislation for the State Association, which I had attended. I reported to them on our discussions. And after some discussion, the committee voted unanimously on the following motion: that we recommend to the 5th District Executive Board that a resolution be presented to the Georgia State Nurses Association Executive Board at its February meeting, asking that they endorse and assume responsibility for action in preparing and presenting through the GSNA Committee on Legislation a mandatory licensure nurse practice act for the 1968 General Assembly.
That's the recommendation.
The recommendations from the Committee on Legislation to this board.
We may get it in there before that time. Because if they're coming in here with all these amendments, we might get to, well, I don't know. I don't know.
If I may, for sake of discussion, Ms. Hudson, the GSNA membership went on record as convention endorsing.
Oh, yes,
Did we
yes.
not? So
Oh, yes.
membership. So
Yes.
all your committee is asking for is that the 5th district, are you asking that the board endorse it, or that we take it to membership and have membership endorsement on?
No, we're asking that the board endorse this recommendation and take it to the February meeting of the Executive Board of the State Nurses Association, so that this group, through the Committee on Legislation, can give the Committee on Legislation, support in working toward introduction of this at the 1968 General Assembly.
We have the recommendation.
I move that the recommendation from the committee be endorsed by this board and be sent to the state executive committee.
They're calling for a resolution to be presented to the Georgia State Nurses Executive Board. Now, I believe our February meeting has been changed to March, but
The next meeting.
yes. We have the motion and a second that this recommendation from the legislative committee that a resolution be presented to the Georgia State Nurses Association Executive Board at its February meeting, asking that they endorse and assume responsibility for action in preparing and presenting to the GSNA Committee on Legislation a mandatory licensure nurse practice act for the 1968 General Assembly. We have a second to that. Is there a discussion to this?
$1968 or 1967?
68.
68.
For the 68 General Assembly. Are there
Time, the members for the recommendation of action.
Is there further comment, question? Hearing none, we will act on the motion then. All in favor of this motion please indicate by saying aye. Aye. Opposed, no. Then the motion is carried.
That completes the recommendations from the Committee on Legislation. And I thank you very much, all of you.
Thank you.
I'm not gonna do it all.
We appreciate your committee's work here. Following up. Now, the meeting was called to discuss these legislative matters and recommendations. We think that we may have one other item that would relate to this. And that is, and maybe Ms. Hudson, you might need to help us with clarification on this. We have just today received a request from the Georgia State Nurses Association 10th District requesting names to the GSNA Committee on Nominations for candidates for appointment as members of the advisory committee to the Board of Examiners of Practical Nurses of Georgia. Is this, the question that we have here, is this related to the board of, a separate board, or is this to the existing board?
Well, the term of office of the advisory committee has expired, and they need to be reappointed. And so I would suggest you go ahead and submit names.
Yes, but, this is the present advisory board as we've known it in the four boards
Yes.
in the past, right?
No, it has nothing to do with the full board. This is the advisory committee to the Practical Nurse Board of Examiners from Practical Nurses.
Yes.
And their terms of office have expired, and Ms. Murphy is one of them, Ms. Lucia Murphy is one of them, Ms. Nita Stevens from Soperton is another, and I am the third one. And I cannot let my name go back to be considered for reappointment. And so I would suggest it. And I believe that these others have felt that they would like to. I don't know whether they would or not. I better not speak for them, but speaking for myself. But I would certainly suggest I see no reason why it's legislation. And this is to the Board of Examiners. Strictly speaking, it doesn't relate to the committee's report, but it is related to the Nurse Practice Act.
Yes. The reason I was inquiring about this is that at the four boards, there was the recommendation that the advisory board be discontinued, but that discussion is void and the board will continue.
The advisory committee will continue.
Yes.
Because the practical nurses agreed not to introduce that amendment.
Yes.
To eliminate the advisory committee, and it's good that they did not, because that needs to continue, and particularly so with practical nurse board composed of all practical nurses.
Then the Committee on Nomination will submit names to the GSNA. Are these also appointed as is the
They'll be appointed they'll be elected, be nominated, and they'll be elected at the February board meeting because they have to fill the office by the 1st of March. And the previous governor wouldn't appoint anybody and wouldn't reappoint anybody. He didn't believe in advisory committees, and he'd have nothing to do with it. But now that we have another governor that's certainly appropriate to present the names to him for appointment. So I would say by all means to get the nominations and get them into the nominating committee of the state immediately, so they can be brought to the fifth district, to the February board meeting. I think that's the reason why that was set up a little bit, so to allow for this.
All right. Are there, names to come from the board or suggestions for this, members of the advisory committee to the Board of Examiners of Practical Nurses of Georgia?
I'd like to submit Ms. Barfield.
Ms. Barfield?
Was Marion Hale in the practical nurse group?
She was coordinator, yes.
I'd like to suggest her name.
All right.
Who is this?
Marion Hale. She was the coordinator in the practical nurse group.
Are there other, we have Ms. Dorothy
You
Barfield.
need six.
Ms.
Yes. So send in six.
Sandra Para is a very fine person, and she's actively in the vocational assignment as a coordinator. Helpful people.
Who has it? Who can find it? I think she's working on it now. Yes,
Well,
she is.
we have,
She does some good work for us, she is.
Miss, Mrs. Margaret Sittenbaum. That's four. Are there other suggestions?
Mrs. Gloria Allen Johnson is the teacher in the program. Gone, actually.
Yes.
Where is she teaching? She's in the vocational school, in the practical department. She's one of my graduates.
Oh, she is, well, I just heard her, she's a member, that's the reason I was.
We have five names.
We'll have to add her, I she's a member, I believe. She's not on our staff, she's on the vocational school staff.
Oh, Ms. Murphy might let her name go back if you need another name. I don't know whether she would or not, but
What's her first name?
Ms. Lucille Murphy from Albany.
From Albany.
You can nominate as many
From,
wherever you
and
stay.
see, these will go to the committee.
I knew it was state, but I thought we were getting from our district, go to the.
We know of others, yes.
You can add as many names as you want, you can send 20 if you want to. If you know any other names, just add them, because there's no limit to it. You see, their names submitted will be voted upon by the, board of the state. And, those receiving the highest number of votes, the six receiving the highest number of votes will be sent to the governor.
We have, Ms. Dorothy Barfield, Ms. Marion Hale, Mrs. Margaret Sittenbaum, Gloria Allen Johnson, Ms. Sandra Parrott, and Mrs. Lucille Murphy.
How about you? Can you serve on that? How about you? That's good these folks are absent, they can't say no.
The jokers in the group, so she was
Miss Jo may serve on this. Miss Jo Goodson.
Well, the more names you submit, the better selection you get. The better, it's fine, you can do it as many as you want to.
She's just joined, not a part of the year.
But these biographical sketches could be gotten out real fast to these people, because you see March 9th is just around the
I have
corner.
some of them, I think.
Or the 11th, whichever is March 11th.
We'll get them out tomorrow.
We'll get them out tomorrow. We have a deadline.
Mary
of
Solomon.
28. I'm
I
sorry.
don't know what her interests are now.
I was wondering about Mary Solomon making cheese just now, and you
administrator at the Macon Hospital.
She's real good.
Yeah, she's a good person.
She's real good. Yeah.
What's
You
her
put her
name?
name
Mary
down, that's
Solomon.
right.
At the Lincoln City Hospital.
She's a real live wire.
Yeah, she's good.
Is that the one that was down at St. Joseph's with inhalation therapy?
She was at the OR in Grady, Hawaii, right outside of school, and she's been in the cardiac care unit at the Macon Hospital, but now is at, I think, the assistant administrator of the hospital. And she's very good.
Are there other names? Then if not, this, really takes care of our, agenda. And before we make a motion to adjourn, I have to know. So, we can have a motion for adjournment, and then if you would give me just a minute for an announcement, I have a reminder to do.
Move it, we adjourn.
Have a second?
Second.
We have a motion to adjourn. All in favor, please indicate by saying aye. Opposed, no. We stand adjourned. At our next board meeting, we are invited to suggest candidates to the American Nurses Association. So be giving it your thought. If you have, persons we would like to, name to as candidates for the, to the nurses, American Nurses Association. And then in the event, some of you may not have seen, there is going to be a short-term professional nurse traineeship program on, improving organization and teaching in service. And on March 17th, this is sort of an announcement and a sort of an involvement too. Mindy Guy, who is a nurse anesthetist, who is on the staff of, George Baptist, is involved in a civic organization that has to do with the planning of the St. Patrick's Parade. And Mrs. Guy seems very enthusiastic about nursing and about nurses and good publicity. Apparently this thing gets pretty wide publicity. She approached a number of the directors, well, she approached all of the directors of the hospitals in the community, some 22 apparently, all of the clinics. And a number of them asked, well, was this something a professional organization, would, accept and endorse? So then she called me, and, a number of the, she had presented this from the standpoint that let's let this be from your institution an outstanding nurse or an outstanding student. The institutions that had the schools of nursing let it be 2 students, and then the institution itself 2, she said, bedside nurses. And then let the publicity come that included in the parade were, she felt celebrities, or the committee felt celebrities of the community. That these are nurses from our own, institutions that were sort of special people. There would be video coverage of really conscientious about this. And, so we're sort of involved, and I did want you to know. And, I got to ask, the public relations chair to also contact these people and let them know that, we're supported as long as it is a dignified presentation. There will be a place in the, grade for the nurse group. Each institution representative has their students and their key grades as nurses. And the nurses will be in uniform. They will, be recognized, and the publicity will be that these are, persons, of recognition in the community. Now, she said this is first time the nurses have been honored. Sometimes they take a group of the, town leaders, and, she spoke up for nurses this time, and wish she could have us. So that, I wanted to fill you in on, and, maybe y'all can get out to the parade.
Well, really now her selected by the membership committee, if they like to have her as their representative on that most attractive.
She was wanting, her suggestion on this, she'd already contacted the institutions, and her suggestion is if you didn't have a school, 2 nurses, she said to give her the patient care that were,
I just wondered if you're gonna look at public health department. We don't have any students, so.
we'll talk with her, and, I think probably, and this is your call, and we should let all of our nursing organizations be remembered. DNA, public health, occupational health, military.
That was a pretty impressive.
Well, she's most enthusiastic about it. She saw this as, being immediate recruitment. She says those youngsters all out of school, and they see this and they be impressed. And, also she really wanted to, do something for, she sees this as, really recognizing nurses in the community. So if you all don't have any objections, as I say, if this is, my thinking on it and discussion thus far was that as long as it is carried out in this light, that it is something all of us would support. But we will give recognition and ask her to include these persons.
Ms. Pope attached to the minutes are the 30 members of the membership committee approved, which will be presented for your approval at the board meeting in March. So Ms. Pope will be bringing them to them. I thought I'd let them know that they will be presented for the official approval.
I do appreciate each of you coming out and, your help with this.
Ms. Pope, I wanted to make one announcement. Have you been receiving the announcements about our grand rounds for nursing? We've been attempting to get them to you the second Tuesday. Is that right? From 2:30 to 3:30 in the hospital auditorium at Prairie View Memorial. We've been trying to conduct grand rounds. They've been very well received.
You seem, you provide relief with these, for our staff.
If you could have, I think it would do a number of things for you if you just get a few people out.
We can
We
go
didn't
in
know
our
that.
best.
I don't know that.
Well, I'll,
I
Miles
have
has
been
been trying to
receiving
get the announcements out. We have a capacity for 289 and they're conducted in such a way that it doesn't detract. But if we had auditorium too, it sort of enhances.
The next one's February 14th from 2:30 to 3:30.